Okay, let's try to understand now the blood pressure in the venous system. And there, as we said earlier, that we are pulling the blood or draining the blood toward the heart. Okay? In the venous system in general, the blood pressure is low. We saw it in the vena cava, it ends around 0, or it ends with 0 in the vena cava, 0 millimeter mercury. And like in the muscular veins, it's around 15, which is even less than what we saw in the blood capillaries. We said in the blood capillaries, 25 to 35. Once we start to the venules, it's more toward the lower values, toward 15 and less. So what causes this to happen? So if we have no blood pressure there, so how is the blood is pulled toward the heart or drained to the heart? Through two factors. The first one is that the blood is moving from areas of high pressure to areas of low pressure, right? That's how the blood is moving. Now, in the atria, in the left and right atria, when they are in diastole, when they relax, the blood pressure there is extremely low. Sometimes it's even 0. So in the heart, remember the atria are the one that receives the blood, right? Especially the right one, because it receives it from the superior and inferior vena cava. So there, it's almost 0. So that is an area of low blood pressure. Therefore, the blood would keep rushing into this area. So this is one factor, that in the atria during diastole, it's extremely low. Then we have two physiological pumps that will kind of, vacuum the blood or drain the blood into the heart. The first one is an easy one to understand, which is the muscles, the skeletal muscles pump. When those muscles contract, or even they have their own, when they set their own tone, they squeeze the vein, and therefore they would push the blood toward the heart. The valves will prevent the blood from backflow. So in the veins, between those muscles, when the muscles contract, they will squeeze the blood. Because of the veins, the blood is moving only in one direction. So this is the skeletal muscle pump. Then there is the respiratory pump. And the respiratory pump is a result of the expansion of the lungs during respiration, during inhalation and exhalation. When we inhale, our lungs will get larger, okay? So they are moving from small to large, and the heart is here. And this, because of this inhalation, this would create a vacuum here, a vacuum in space in the lungs. So the blood would try to fill this space in the lung, and therefore, and it has to come to the heart first. So this is the second physiology pump. So inhalation will drop the blood pressure in the lungs or in the veins of the chest area, and therefore this is another factor. This is another area of low blood pressure, or the blood would rush into the heart. Okay, so that is the respiratory pump. We will talk about the changes in the pressure and the relationship with the lungs with the size of the lungs in the respiratory system, and maybe then we will understand this better. So what are some of the clinical applications of the blood pressure? Of course, the hypertension, the most common one. In hypertension, we will call it hypertension when the patient sustains blood pressure of 140/90. Okay, that is hypertension, high blood pressure. Usually 120/80 as the max. That is the higher normal level. But after that to 140/90, that is the pre-hypertension. And from that, after that is hypertension. Now, the hypertension by itself would not cause any symptoms. Okay, that's why sometimes it's called the silent disease, because suddenly it will attack. Suddenly it will cause heart attack or stroke. Some other problems with the hypertension is that the ballooning of the blood vessels, so they will expand, but their ability to recoil is reduced because of constantly they are expanded. So kind of those elastic fibers will lose their ability to recoil. Sometimes it will cause some arterial diseases, peripheral arterial diseases, sometimes chronic kidney diseases, and sometimes even will cause heart failure. Those hypertensions, based on the reasons, we will have either primary one, that's 90% of the patient, and here there is no underlying cause of it. There are risk factors, however, like obesity, smoking, diet, age, heredity. All of those factors will contribute to the primary hypertension, and this one can be controlled. It can be cured, it can be controlled through changes in the lifestyle. And the second one is the secondary hypertension. This is very rare, like 10% of the hypertension patient, and this is usually because there are problems in other organs, maybe in the kidney or maybe in the glands of the body. So for this one, treatments is to treat the cause of it. Hypotension is when we have low blood pressure, 90/60 or below. By itself is not a problem unless it comes with other symptoms like short breathing or inability to perform simple tasks. But as we age, we are going to lose that blood pressure. So in elderly people, 90/60, it's totally fine. Another thing that related to the blood pressure and the blood vessels is the hemorrhage. The hemorrhage is the loss of blood that cannot be controlled by homeostatic mechanism. So think, for example, you have a big cut in your arm because of an accident or something. That is a hemorrhage. In labor, when some moms are delivering, they will lose a huge amount of blood. That's a hemorrhage. Or because of an accident or a hit, you will have internal hemorrhage. You're losing blood into the cavities of the body, not toward outside the skin, but inside. So that's internal hemorrhage. All of those are loss of blood outside the blood vessels. The blood is moving outside the blood vessels, and that will cause a drop in the blood pressure, and that will cause circulatory shock. Okay, and this is of course life-threatening situation, because now we don't have a blood enough in the blood vessels to deliver oxygen to different parts of the body, mainly to the brain, to the heart itself, to the liver, to the kidneys. All of those are very essential organs that any drop in the oxygen levels, in like any form of hypoxia, might lead to death in them. There are several types of shocks. All of them are kind of the same concept. We are losing blood somehow, and we are losing the ability of the blood to deliver oxygen. But depending on the cause of those, shocks, we have either hypovolemic shock. This is a result of the drop of the volume of the blood. This is usually because you are losing blood because of a cut or during labor or internal hemorrhage. So the blood, this one is we are losing the volume of the blood, sometimes because of severe dehydration or, insipidus, diabetes insipidus. All of those might form a hypovolemic shock. Then we have cardiogenic shock. This is when the problem in the blood circulation is coming from the heart. So there is blood vessel, there is less blood delivered to the cardiac muscles, and therefore the heart cannot give or cannot sustain its contractions. Okay, so there is no cardiac output. This is usually when we have heart attack. Sometimes it might caused by arrhythmias or valve disorders or cardiac disorders, and different reasons. But in general, when we have cardiogenic shock, that is when we have a problem in the blood vessels or problem in the blood pressure related to the heart. Then we have the vascular shock. This is when we have a problem in the blood vessels. So those are, especially the arterioles, they cannot maintain their normal muscular tone, and they will dilate dramatically. So they will be open, and that will cause low blood pressure in that area, and therefore sometimes the blood will get stuck. Remember, in the arteriole, like just before the blood capillaries, right? So maybe that in the blood, in the arterioles, it will drop to 35 millimeter mercury because of that dilation, which is the same in the blood capillary. And therefore, there is no force to drain that blood or to push that blood toward the blood capillary. Okay, so that's when we have the vascular shock. So I'll stop here. In the following video, I want to talk about two things. One is the hepatic portal system, and the other one is the fetal circulation. Both of them, we will see them mainly in the lab.